Growing up, Humberto Monge had dreams like any other kid.
For me, it was playing baseball and being a professional baseball player or playing football, that sort of thing. And, you know, as I never grew up to be 6'4", 280, football went out the window. Baseball was what I pursued, but, you know, things change.
His family had modest means, but growing up in New Orleans in the 60s and 70s presented other challenges.
I was a dark-skinned, curly-haired kid, and it was hard, very hard. Trying to live in the Deep South with dark skin and trying to navigate that world. We were the only minority in our neighborhood, and you knew it. Bullied, taunted, you know, derogatory words. I can remember them as if they were yesterday.
The Navy offered a way out. A recruiter told him an aptitude test suggested two options, machinist mate or corpsman.
He said, being a machinist mate, you work in the hull of a ship at 100 and some degree temperature. You work 36 hours a day. You've never seen the light of day when you're out to sea, versus a corpsman where you take care of patients, you work with physicians. You can work in hospitals in Europe, in the Far East on ships, or if you like the outdoors, you can hike and go camping and take care of Marines. And I thought, well, that sounds like a better option than being a machinist mate. And so that's what I went into.
He would serve 25 years in the Navy as a hospital corpsman, surgical technician, and medical service corps officer.
And the medicine world just opened up, and I really enjoyed it tremendously.
A Navy surgeon had suggested college, so when his service ended, he pursued a public health degree at SDSU.
Just the college experience was very vibrant, very new, very inviting. The faculty was very helpful in terms of engaging with me and the other students, answering questions, you know, faculty hours, all that stuff in terms of me expanding my horizons.
For the kid from Louisiana, those horizons reached all the way to Stanford and a physician assistant position caring for transplant patients.
They're on their end stage of life because of their organ disease. So being able to do something for them to completely change their lives is very rewarding.
And so is his work in the classroom, where he teaches interns, residents, medical students, and others while modeling the instruction he received at SDSU.
I have been honored by multiple teaching awards for me doing what I learned from what I received here. And that was that foundation.
Today, he and his wife seek to preserve and strengthen that foundation for students through their Eileen and Humberto Monge Scholarship in the College of Health and Human Services.
San Diego State is a very easygoing, helpful community of faculty and students. Where everywhere you go, someone's there willing to help you in whatever you need. And that's what I saw when I came to school here, and that hasn't changed. The buildings have changed, but I think the core of the community of this institution has not changed, and that's what I enjoy.